Hello, everyone. My name is Sophia Chavez. For my signature assignment this term, I picked kidney nephrotic and nephritic syndrome. So a quick overview of what I'll be going over is what is kidney nephrotic and nephritic syndrome? Why does this happen? The etiology, demographics, anatomy, physiology and symptoms, as well as diagnosis and treatment. What is kidney nephrotic and nephritic syndrome? So these syndromes are two different syndromes that affect the filtration system of the kidneys. Why does this happen? So the nephrotic syndrome is caused by changes to the glomeruli. This causes a massive amount of proteins to pass through the filtration system. The nephrotic syndrome is caused by inflammation to the glomeruli. This causes blood cells and a mild amount of protein to pass through the filtration system into the urine. The etiology of both of them. So for nephrotic, it is unknown why these changes occur to the glomeruli. Some disorders that may lead to nephrotic are diabetes, amyloidosis, lupus, minimal change disease. Some infections that lead to nephrotic syndrome are HIV, hepatitis C, and hepatitis B. Genetics, so the reason why it could be linked to genetics is because of a mutation to the podocyte protein, for example, the podocin or the nephrin. Behavioral, there could be drug abuse that can be linked to nephrotic, such as heroin. As for environmental, mercury and lead exposure may be a contributing factor to the development of this syndrome. And for nephritic, inflammation of the glomeruli happens because there is buildup of antibodies, such as a response to an infection. It is common for children who have had strep throat to develop it 7 to 10 days post-infection. So this is just like the body is building up antibodies to fight the infection, and some of these antibodies get congested in the glomeruli, and so then it inflammates the glomeruli. Some reasons for adults to develop nephritic syndrome is again, as well as the nephrotic, is through bacterial or viral infections, like hepatitis B and C, streptococcal endocarditis, and pneumonia. There's no correlation really between the environmental or behavioral with nephritic syndrome. As for the demographics, diabetic individuals are more likely to get nephrotic syndrome. And in the US, there's 50 cases per million in general in the US population. And then among children, the occurrence of nephrotic syndrome is lower, around 20 cases per million. As for nephritic, adult women and people older of age are more likely to get nephritic syndrome. And it was ranked the 9th leading cause of death in the US. And then the mortality rate increases with age. So the anatomy of the kidney, the kidneys are two bean-shaped organs that are located in the posterior part of the abdomen, in the upper retroperitoneal region. The function of the kidneys are responsible for maintaining fluid and electrolyte balance, regulating blood pressure, and filtering waste products from the blood to form urine. And then the nephrotic and nephritic syndromes affect the nephron and the glomeruli by either inflammation or changes to these tissues. And as you can see, like on the right-hand side, the nephron, so the glomeruli are these capillaries here, and this is the Bowman's capsule, and this is where it either gets inflamed or changes, and there's excessive protein or blood being passed through this area here. So the physiology for nephrotic syndrome, happens when there is changes to the glomerular filtration barrier, such as effacement. So what effacement means is like a thinning or changing of the capillaries. The GFB is made up of 3 layers: fenestrated endothelium, the glomerular basement membrane, and podocytes. When these areas get damaged, when damages occur to the glomerular basement, it loses its negative charge, allowing the passage of massive amount of protein to go into the urine. As for the nephritic syndrome, this occurs when there's a structural issue, such as inflammation because of antibody buildup, in the GFB, the glomerular filtration barrier. The GFB is made up of again 3 layers, the same as the nephrotic syndrome. The filtration system is selective in what passes through based on the size and charge of the product. And when there's change in the structure, it allows the wrong products such as blood and protein, to pass through the filtration system into the urine. Sorry. And so as for the symptoms of these, for nephrotic, the asterisks are what's really different between both of these syndromes. So in nephrotic, there's massive amount of protein that is being outputted through the urine. And then the urine could be foamy or frothy urine. And then hypoalbuminemia. Albuminemia is it's the protein that is made by the liver. This protein it is essential in the hemostasis of like the blood regulation, with the blood the blood gets attached to the water through this protein, and so this is like pretty much what helps the body regulate its water in the body. So there's also hyperlipidemia, and then there's also edemia, which is there's weight gain, there's weight gain because of water in the face, abdomen, and extremities. So for the nephritic, there is blood in the urine, there's hypertension, and then there's low glomerular filtration rate. There's also decrease in urine output, swelling in the eye socket, legs, arms, hands, feet, and abdomen, high blood pressure, and proteinuria, which is mild. There's not that much protein in the urine. So again, this is just kind of like a diagram of how and what is happening. So the key differences here are there's inflammations disrupting the glomerular basement, and then in the nephrotic syndrome, there's changes to the glomerular region. And yeah. Sorry, give me 1 second. As for diagnosis, the urine analysis. For diagnosis in nephrotic, there is urine analysis. It reveals a large amount of protein in the urine. For blood tests, there's also blood tests. A blood test can reveal low albumin levels and reduced all overall blood protein levels, and then you can also do a kidney biopsy. For nephritic, there is urine analysis also, and this reveals a mild amount of protein with red blood cells. There's also physical examination looking for high blood pressure and edema, and then also again a kidney biopsy. As for treatment, they're pretty much somewhat similar. I think the only key differences here are the immune system suppressing medication. So for nephrotic, there is blood pressure medication called angiotensin converting enzyme. which inhibits the reduced blood pressure, and the amount of protein released in the urine. And then there's diuretics, which is water pills. These control the swelling by increasing your kidney fluid output. And then, so for nephrotic, because there is a buildup of antigens in the glomeruli, this suppresses the immune system, like corticosteroids can reduce inflammation linked to certain conditions causing nephrotic syndrome. As for nephritic, blood pressure medication, also, and then water pill, diuretics, immune system suppressing medication, antibiotics, and dialysis for severe cases. So side effects of these medications include diarrhea, dizziness, headaches, muscle cramps, dehydration, difficulty breathing or swallowing, blisters, or peeling skin, and then blurred vision. For nephritic, the outlook varies based on the patient's age. In children, it often follows a short-lived course with a positive prognosis. However, in adults, it tends to be more persistent and can lead to chronic renal failure in significant percentages, 20 to 74 of the cases. For nephrotic, the prognosis is usually excellent, and most recover with corticosteroid treatment. However, there is a risk of relapse, which can lead to the complications such as steroid toxicity and infections. As for artificial intelligence, there is no specific model out for nephrotic or nephritic syndrome, although there are developing models for all renal pathology. And they're using image data input, staining method, and deep learning tools for early and accurate diagnosis. And these are my references. Thank you guys all so much.